It doesn't take a lot of time for frostbite or hypothermia to set in, and then the snow on the roads can make things worse for people trying to get to the hospital if they're suffering from a medical emergency. I want to bring in Dr. Jerry Cauwels now, Chief Physician at Sanford Health in Sioux Falls. Thank you for being here. All right. So how long does it take for frostbite, hypothermia to set in if somebody finds themselves out in the elements?
If you end up exposed in this kind of temperature, you're really talking about minutes for frostbite. It could be less than 10. We're seeing 50 below zero out currently with wind chill, and that kind of wind blowing across your skin, especially exposed, can have you in trouble in minutes.
So what are the symptoms you should be watching for? Because oftentimes I think people are outside, they're scraping off their windshield, they're trying to clear their tires, and they don't really pay attention to what's happening with their body.
Yeah, I think you're absolutely right. The redness or pain of the skin, even evolving into sort of a waxy feeling on it as it gets even colder. And then numbness is probably the other thing that I would tell people to absolutely watch out for. You want to make sure that if you're experiencing those symptoms, you can get that exposed skin covered and hopefully out of the elements as soon as possible.
Okay, so say you've got the exposed skin, you're starting to notice these symptoms, you head inside. What are the remedies inside to warm up safely?
I think the first part is just to make sure you can either cover it or get it someplace where it can maintain sort of a room temperature warmth. What you don't want to be doing is running things under particularly hot water or extremes of temperature, but rather just to make sure you're doing everything you can to get back to a normal temperature as smoothly and quickly as possible.
Okay, and we're talking about frostbite. How about hypothermia? What are some of the things that concern you the most in these elements?
So hypothermia is really when the whole body starts to get that cold. And when it does, the important part is to recognize that your brain isn't going to work like it's supposed to. You go all the way from shivering and exhaustion to confusion and memory loss. And as you're doing that, to recognize that and make sure you can get somebody else to help you is absolutely key.
And what should they do?
I would make sure you're calling either your local medical providers or a local friend if you have somebody close. The biggest difficulty right now in South Dakota is 50 below is colder than we can actually transport patients. So we have trouble getting to the middle of those states where you just showed those clips of the weather. The roads are closed, the airports are closed, and finding assistance sometimes is extremely difficult in those situations.
Right, so you can't get to them, which means they also can't get to you.
Correct. There's a time for any illness where we can make a difference. And unfortunately, these kind of weather patterns really make it difficult for us to get to people in that appropriate time.
So we're looking at a live picture of the conditions right now. You guys are used to cold, but this is a different kind of cold. Does this feel worse than what you've experienced? Are you more concerned about this system?
I think this system really comes on the heels of a really large snowfall, which we were still trying to dig out of. There are portions of our state where the interstate has now been closed for 10 out of the last 14 days. And as you're doing that, people's access to food, people's access to fuel, people's access to the things they need every day become less and less. And those unfortunately cause people to make choices that probably aren't in their best interest.
We've been talking for days, Doctor, about hospitals across the country that are inundated with flu, RSV, COVID. How are your emergency departments right now in terms of managing overflow? Are you at capacity even ahead of this storm?
We are busy, and we have been busy to the point of being at or above capacity, what seems like for 3 years now, but certainly here during this last month or so. Each day is a new challenge to make sure we can take care of all of the patients that come to our doors.
What's your advice if people can't get to you and you can triage over the phone, who they should call, what their first step should be, whether it's an illness like the ones we've mentioned or it's a cold weather related injury?
Absolutely. So video visits right now have revolutionized healthcare, and I think this is the perfect time to use them. It gives your doctor the ability to use your cell phone to take a look at what you're concerned about, as well as to have a sit-down conversation about what you can do to help yourself.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.